The definition of gestational diabetes that glucose intolerance glucose tolerance, which reveals him during pregnancy, usually during the second half of it. There is an increase in normal blood sugar levels when fasting, and after eating, as well as an increase in the insulin reaction. After pregnancy, blood sugar and insulin levels drop, and diabetes will go away. However, many women who suffer from gestational diabetes have an increased risk of developing type 2 diabetes in later years. Causes of gestational diabetes. The exact cause of gestational diabetes is still not known. Some researchers link gestational diabetes with hormones produced by the placenta, such as HPL, progesterone and estrogen, that reduce the effect of insulin in the cells of the body, which causes increased insulin secretion from the pancreas. Additionally, recent studies indicate the presence of additional substances, such as leptin, restin, and cytokines, that cause gestational diabetes. There may be some different genetic influences. For example, a defect in the structure of the enzyme glucokinase, which mediates the secretion of insulin from the pancreas. Risk factors for gestational diabetes include age 25 years and over, having diabetes before pregnancy, obesity and weight gain. The effect of gestational diabetes on the fetus. Excess sugar in the body passes to the fetus, which causes the fetus to secrete high levels of insulin. Insulin can act as a growth hormone and may cause the fetus to grow excessively. This phenomenon is called macrosomia. Very large fetuses can cause complications during pregnancy and childbirth, with tears in the birth canal and pelvis, and therefore a cesarean delivery is inevitable. When it comes to a fetus weighing more than 4 kilograms, a cesarean section is highly recommended. In addition, infants may develop hypoglycemia, seizures, or jaundice. Babies of mothers who have had gestational diabetes are also at risk for increased obesity and type 2 diabetes later in life. In addition, gestational diabetes is a risk factor for high blood pressure in pregnancy, preeclampsia, and complications that can cause disease and death for both the mother and the fetus. Diagnosis of gestational diabetes. Every woman who undergoes screening for gestational diabetes within routine tests during pregnancy, provided that she did not suffer from diabetes before pregnancy or had gestational diabetes in the past. This test is done at week 28 to 24 of pregnancy, or earlier if there are known risk factors. In this test, the blood sugar level is measured 1 hour after drinking a solution containing 50 grams of glucose. If a value higher than 140 mg per deciliter is obtained, the doctor will direct the pregnant woman to more accurate examinations, glucose tolerance test, for this test, which must be addressed in the fasting state. Blood sugar levels are checked several times during a fast after drinking a solution containing 100 grams of glucose until after 3 hours. If 2 or more outliers are present, gestational diabetes can be diagnosed. It should be noted that for fasting women whose glucose value is more than 95 mg per deciliter, without other abnormal values, it is recommended to lower blood sugar levels through various measures to treat gestational diabetes. Treatment of gestational diabetes. There are several therapeutic measures that can be taken to treat gestational diabetes, and these are the most important of them. 1. Follow-up glucose levels should be monitored during fasting and after meals, and the development of the fetus must also be closely monitored. 2. A good diet. A diet should be followed to maintain a normal blood sugar level that includes foods high in dietary fiber, such as vegetables, fruits and whole grains that do not cause a rapid rise in sugar levels and the release of insulin in abundance. It is recommended to reduce the consumption of sweets, and it is best to avoid them. 3. Stay away from sugars. You should stay away from simple sugars, such as soft drinks and juices. Pregnant women can use artificial sweeteners instead of regular sugar, but after consulting the doctor and choosing the types that have been proven by research to be safe for the pregnant woman. 4. Incorporation of appropriate exercises for pregnant women. Exercising causes blood sugar to enter cells and increase their sensitivity to insulin.